Next tonight, the NHS says hospitals are being hit by a tidal wave of flu. It means more and more beds are being taken up by those with winter viruses. Here in Yorkshire, 95% of beds are occupied across our 11 hospital trusts. Our reporter Heidi Tomlinson has been to one A&E department where patients have been warned to expect to wait for up to 6 hours before being seen by a doctor.
An influx of illness. Huddersfield Royal Infirmary is much busier than this time last year. The hospital is full. Some patients are waiting hours to be seen and admitted.
So the waiting rooms got busier throughout the morning, and what we have seen throughout the week is hours of 20 to 25 patients per hour attending for multiple hours of the day.
There are very few seats left for people to take.
Unfortunately, that's not uncommon. We are seeing more and more patients attend, which again does result in a lack of space within the waiting room for patients to wait to be seen by a doctor.
So what's the current situation here? You put a message out on social media telling people to expect very long waiting times. How many hours would that be?
We're seeing 60 more patients per day than we were the same week last year. We have seen patients wait up to 5-6 hours to see a clinician, but again we do always ultimately make sure that the sickest patients who attend and need medical attention immediately are seen as a priority.
Okay, so we've had to come out of this cubicle now, Tom, because it's needed for a patient.
Yeah, so this is our resus room, and that's now all of our cubicles full. This space is used for the most critically unwell patients that need life-saving intervention, and all of these rooms are now full.
This week, 96% of beds are occupied in Huddersfield and Calderdale hospitals. It makes for a prolonged transition from A&E to ward.
We've got this patient, mental health, awaiting bed, and she's been here for 17 hours.
Why do you think it is more busy this year than it was last? I mean, the NHS are talking about a tidal wave of flu. Is that something you're experiencing?
We are seeing some patients present with flu. There are also patients who present with pneumonias and sepsis and other respiratory illnesses. We do tend to see spike in winter. I think one thing we have noted is that spike seems to have felt as if it's come a little bit earlier this year.
So what's your advice? If people come to A&E, they're clearly feeling very poorly and they want immediate medical attention.
Absolutely. I think the key message is today is that we're here and we're here to support patients that are critically unwell and need our services. One piece of advice we always give is that there are other services available. They can be accessed through the 111 online.
Do you think some people can't get a GP appointment?
I think there are challenges throughout the system, and I think that's why I would always advise those patients to use those signposting services.
Nationally, numbers of flu patients in hospital are 3 times higher than last year. People are being urged to get vaccinated to relieve pressure on the NHS. Heidi Tomlinson, BBC Look North, Huddersfield.